it's titled the Information Governance Toolkit, and that's a reference to the resources which are on the Health and Social Care Information Centre website. They've been developing an information governance toolkit over many years. They're well up to, I think it's version 12 or so, for some aspects of it anyway, at the moment. And it's described as being the Department of Health's repository of information governance policies and standards. And there's a whole team of people in a regular review process for updating things as they go through the years. So again, it's very easy to find. Just put in Information Governance Toolkit into the search engine of your choice, and the HSCIC link will be pretty close to the top, if not at the top. But in the context of the conversations we're having today, the points that you might want to have a think about and perhaps discuss amongst yourselves are, what does it mean to be sharing information? It's a common concern. On the one hand, you're encouraged to share. On the other hand, you're encouraged to not share because of concerns about this, that, or the other. There's a delicate balance to be struck here. But there are different purposes for sharing, and different purposes may have different constraints and opportunities. So if you're sharing for the three categories that we have here, the things to do with direct care, dealing with individuals, there are proposals out there for changing the rules, modifying the rules, softening the rules in some cases. But equally, there's tremendous pressure on the public side to be tighter on sharing. Our data is valuable, our data is very personal, and many people are pressuring for more restrictions on sharing rather than more sharing per se. So we need to develop new ways of doing things. So the politicians are involved, guidelines and advice for the frontline staff. Perfectly reasonably, they're going to come and ask you questions. What am I allowed to do? What am I not allowed to do? So the policies and the practices that you need to have in place are something that you need to evolve locally, but be consistent with these national and sub-national guidance packages. So things like the Information Governance Toolkit is a place to go and see what the recommendation is at the Department of Health level. When it comes to supporting the commissioning functions, there's all sorts of regulations and rules that have to be followed, and these are evolving as well to meet the new circumstances. When it gets down to, let's say some of the behind-the-scenes activities like research, those of you who have been following the care.data programme will know that what that programme is about an explicit intention to integrate yet more data together and make it available for more purposes, both for the research community in the academic sense, but also for the research community in the commercial sense, commercial organisations, data mining the information for both commercial and health benefits. There's a whole bundle of stuff still working its way through on that front. There's a very stuttering launch of the care.data programme about 6 months ago, or more than 6 months ago, and it still hasn't come back out yet. But that's going to involve GPs and the health services primarily. To what extent it'll overlap the social care side of things, personally, I'm not sure. On the governance and accountability, the likes of the Information Governance Toolkit, these are documents and practices and review procedures that you can engage with if you want to. It's not a closed group exercise. You can get involved, or alternatively, you can just wait and see what the results are and take those as a model either to apply or to adapt for your local circumstances. So there is robust oversight. The intention is that there's an assurance of what constitutes good practice, not best practice, the single thing which is the right way to do it. There may be varieties of good practice, and who knows, you may be able to add to that by your own particular innovative solution to this kind of problems that you have locally. So just to finish on the local point, the question that I want you to spend some time discussing is basically, how well do you feel you are prepared in your own locality? You can define that as narrowly or as broadly as you wish around your table. But how well prepared are you for your information governance arrangements to enable these new processes? So are they hot to trot? Are they ready to go? Do they need to be made? You haven't got any, they get in the way, whatever. Please discuss and comment and perhaps be prompted by those sort of things. New ways of working, barriers to means of delivery. Co-creation is a great opportunity, but it can be difficult to do if you've got all sorts of rules and regulations stopping you from doing things. Integration, personalization, etc.